Minoxidil is a topical medication used to treat hair loss and baldness. It was first developed in the 1960s and has been approved by the FDA for use in the United States since 1988. Minoxidil works by increasing the amount of blood flow to the scalp and stimulating the growth of new hair. It works best when used with other treatments such as Finasteride and biotin. It can also be used alone, but the results are not as dramatic. Hi, I'm Janos from HairPalace Hair Clinic, and as a patient coordinator I have accompanied the treatment of more than 1,500 patients in the past 5 years. Join me as I dive into the mechanisms behind how Minoxidil works, its side effects and different formulations and alternatives. Minoxidil is a vasodilator. This means that it widens the blood vessels. In fact, when Minoxidil was introduced nearly 4 decades ago in 1986, it was primarily used as a way to treat high blood pressure. Only later did doctors find out that the effects of Minoxidil may also be beneficial for hair follicles and hair growth. The 2% formula proved to be extremely effective in increasing the blood flow of patients. This happens because the widened blood vessels allow more nutrition to reach the follicles, and the increased blood flow also helps to deliver more hormones to the follicles. The hormones stimulate the follicles to enter the growth phase and new hair begins to grow. Aside from the vasodilating effects, Minoxidil also provides anti-inflammatory and anti-androgenic effects which may contribute to its benefits on hair health. The most popular product that utilizes Minoxidil is Rogaine. This brand offers topical Minoxidil products in 2 and 5% formulations. Rogaine offers products for both men and women. But Minoxidil is also available in generic forms, and it's also sold as a tablet. The tablet version is used to treat high blood pressure, while the topical solution is used for the treatment of hair loss. Rogaine offers several products and they come in various sizes and concentrations. 1 month's supply of their 5% extra strength scalp solution for men costs £37, while the 2% regular strength solution for women costs around £26. Other products are similarly priced, and you have the option to buy 1, 3, 6 or an entire year's worth of supply in one go. Generally, it takes about 8 weeks of consistent use for patients to notice any results. At 4 months, hair loss should have stopped, with new hair growth developing. When patients start a course of this treatment, they might become alarmed that they are losing more hair than usual. Don't be alarmed, this is to be expected. The active ingredient in Minoxidil speeds up the resting phase of the hair follicle. But Minoxidil also extends the growth phase, leading to stronger, longer, thicker hair regrowth. However, one thing to keep in mind is that while Minoxidil can create stunning results, it is not a permanent solution for hair loss. You will need to apply the treatment indefinitely if you want to hold on to any newfound hair growth. Sadly, this means that while the price of Minoxidil is rather cheap, this treatment option is a recurring expense. According to most studies, Rogaine works best in people with hereditary hair loss at the vertex of the scalp. Vertex refers to the area located at the back of the head, but it was also shown to be effective for women with general thinning of hair on the top of the scalp. However, a 2014 study also showed that it may work for the front of the scalp as well in men. In fact, a 2002 study showed just how effective this treatment can be over the course of 48 weeks. Participants who used 5% topical Minoxidil compared with 2% topical Minoxidil experienced quicker results as well as 45% more hair growth. The researchers of this study also showed that the participants who used the 5% topical Minoxidil had improved psychosocial perceptions of hair loss. You should always talk with a doctor if you intend to use Rogaine or other Minoxidil products under the age of 18. You should also avoid Minoxidil if you experience symptoms of alopecia areata. This typically means sudden hair loss that happens in patches. It may affect your scalp, body, and even facial hair. Furthermore, if you experience unexplained hair loss or hair loss after giving birth, as well as a discolored or infected scalp, it's probably the best to stay away from topical medications such as Rogaine. Lastly, if your hair loss is due to thyroid issues, nutritional deficiencies, scarring of the scalp, or hair loss due to cancer, you should most likely avoid Minoxidil products. Rogaine is clinically proven to be effective against hair loss. It is one of the only 2 hair loss medications approved by the American FDA along with Finasteride, but more on that later. Most side effects of Minoxidil are considered low risk and relatively easy to manage. You may experience scalp irritation if you have sensitive skin. Certain patients may also notice unwanted facial hair growth as well as a shift in the color or texture of their hair. It's also common to see hair growth in unusual places such as the forehead or hands. At the start of your Minoxidil regimen, you will most likely go through a period of increased hair shedding. However, this is not a side effect you should be concerned about. This is due to the stimulated follicles pushing out older hair and clearing the way for the new growth to occur. Severe reactions to the medication are rare, but they can cause serious issues. This can include dizziness, increased heart rate, or even heart disease. You may also feel chest pain, go through a sudden unexplainable weight changes, and even develop swollen feet or hands. It is crucial that you contact your doctor as soon as you notice any of these complications, as they can cause serious long-term health effects. Finasteride is the other largely popular hair loss medication which acts as a DHT blocker. It has been shown to be effective in the prevention of further hair loss in men with male pattern baldness, although it tends to work best when used at the earlier stage of hair loss. Recent studies suggest that using Finasteride and Minoxidil together may yield the best overall results. However, this treatment suffers from the same issue as Minoxidil, namely that it must be taken each day to provide any changes. While both of these treatments are scientifically proven to combat hair loss, neither of them offers a long-term solution. The only treatment that can restore your lost hair and help you say goodbye to baldness once and for all is hair transplantation. This simple one-day procedure can effectively restore your confidence and help you achieve the head of hair you've always dreamed of. Which medicinal hair loss treatment would you rather choose? Minoxidil or Finasteride? Or maybe both? Let us know in the comments below. And if you enjoyed this video, subscribe to our channel. We post new videos every week so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.